So in this next segment, we have set aside some time to answer some questions that were posed. So during the registration process, we did have a little Q&A box asking if you have any questions to ask Dr. Valerie Tay. So there were quite a few questions, but we just chose a few because we want to make some time for the live Q&A section as well. So the first question that we had was, will doing an operation to remove excess polyps in the nose help? Rather than like the throat and stuff.
Okay. Now, I did mention just now that the obstruction of the nose can contribute to sleep apnea, but it isn't usually the cause of sleep apnea. It is important to do nose surgery as a part of other treatments of OSA, because if you can breathe well through your nose, then it'll be easier to use the CPAP mask at night. So if you do have nasal polyps, then yes, I would say that it would improve your breathing. It would probably make it easier for you to use your CPAP at night, but it would not cure your OSA.
Yes. Okay, so it will be, it just helps with the CPAP, and then there are other treatment modalities besides just the nasal polyp removal.
That's right, yes. It's more for breathing than for the OSA. Yes.
Okay. Then let's move on to the second question. So I thought this one was pretty interesting. Since the tongue can kind of collapse and then it causes the throat to be obstructed, right? Can you exercise the tongue and strengthen the muscle so it holds itself, and then you prevent that droop and you prevent the snoring?
You know, that's a very good question. It's not something which we learned about when I was still a medical student or when I was a very young trainee. But in the last 5 years to 8 years, there's been more research and studies done into what we call myofunctional training. So myo means muscle, functional, you know what that means, and training. So it is a group of different types of exercises done to strengthen the jaw, to strengthen the tongue muscles in various positions so that the tone will be better at night. And yes. So it's quite interesting. The studies that have been done show that it does improve snoring in about 50% of patients. And in certain patients as well, it does improve the OSA, right? But it's not suggested as an isolated treatment. It should be in conjunction again with other types of OSA treatment as well. And to note, when I did look through those studies, the patient pool tended to be not the super obese. The BMI was not like 30 or 33. It was more like maybe the BMI between 24 to 28. So they may be a little bit overweight, but they weren't morbidly obese. So, I mean, if you are obese, then clearly there are other issues at hand that you have to address to treat OSA. But yes, in certain patients, the tongue exercises would help. It's called myofunctional training.
Myofunctional. Actually, when you talked about the muscles for the jaw and the tongue, I was thinking of those people who do for face slimming. Do you think that will help with the face slimming?
I wish.
Okay. So these are the two pre-registration questions that we've got. Okay. So I see that there's already quite a number of Q&A questions, and then there were some in the chat as well. So if you have yet to do so, everyone, please type in your questions that you have for Dr. Valerie in the Q&A box. So that's the one with the 2 speech bubbles that you can find at the Zoom toolbar. And if you want to keep anonymous, just remember to click the send anonymously checkbox before you post your questions. So let's just see. The first question that we have is from anonymous attendee. Where can you do a sleep study in Singapore? So I do remember you said that part where you can do a sleep study. Is it something that we can just go and find to do?
Okay. I would advise that you first see an ENT surgeon to assess whether or not you need a sleep study. They also have to assess your airway anatomy. Subsequently, the ENT surgeon will arrange a sleep study for you. Now, that can be done in the hospital, as I mentioned previously, in a sleep center, or they may arrange for a sleep study to be done in your own home. So that's become very popular nowadays because of COVID, because a lot of patients prefer not to be in the hospital. And actually, if you sleep at home, you feel more comfortable, it might be easier for you to fall asleep and for us to get good readings during the sleep study as well. The advantage, however, of doing it in a hospital is that if any of the electrodes gets dislodged, or if you have any issues during the sleep study, there's a technician that can come in to help you with it. If you're at home, you are on your own.
So it's not really something that anyone who is curious about their sleep can just go and sign up for now.
No, this typically has to be ordered by a physician. And well, you can see me in my clinic and I'll organize one for you. Yes.
Okay. So the next one is, why is going to the toilet to urinate frequently at night related to OSA?
Yes, good question. Now, in patients who have OSA, there's actually an increase in their abdominal pressures and increase in the secretion of a hormone called the ANP hormone. It's atrial natriuretic peptide, ANP, N for Norway. And that hormone causes increase in production of urine. And that makes the patient have to wake up at night to go to pass urine. But of course, if the patient also has a prostate problem, then that may also contribute, because again, older men tend to have OSA, isn't it? So you should also have that checked out if you have an issue of frequent urination at night. Yeah.
Yes. Right. So even though it feels unrelated, there's actually there's a link.
Exactly. Yeah. Okay. And some patients, they get used to it. Like they think that it's normal because they've just been doing it for so long. It's like blocked nose. I've seen so many patients where I'll ask them, do you have nasal obstruction? Is your nose blocked at night? Or sorry, is your nose blocked in the daytime or at night? And they say, oh yeah, but it doesn't bother me anymore. I've been living with it for so many years.
Yeah. I find that quite common also. Like even my brother, he has this nasal obstruction, and he's just like, he'll just blow his nose and then he'll think it's all right. Or maybe he needs to get checked. So our next question comes from Ms. Janet Lim. Hi, doctor. I feel like my sleep is not good, but my husband don't say I snore. So is it possible that I have sleep apnea, but I don't snore?
Okay, so poor sleep can be due to many, many causes. Sleep apnea is just one of them. Insomnia, having stress, for example, poor sleep hygiene. These are some of the more common causes of feeling that your sleep is not good. Sleep hygiene means that you have to go to bed at the same time every night, wake up at the same time every day. It doesn't matter whether it's the weekend. You don't sleep a little bit more because you can. Don't take naps for more than 15 minutes in the daytime, because then that causes you not to be able to sleep at night. If you take a nap at 7 p.m. for 1 hour, isn't it? And something which I'm absolutely guilty of, using your devices in bed, right? So the exposure to that blue light tells your brain that it's not nighttime yet. It keeps the brain active and awake. And then, we can't get a good night's rest, right? So there's so many reasons. OSA is just one of them.
Yeah, I think, maybe OSA is just like it obstructs the nose, so you have poor sleep, but then you could have poor sleep from so many other reasons as well.
Absolutely. I think a lot of it is lifestyle, stress, and doing so many other things in bed when we shouldn't be. The phone is the main problem, I think.
Yeah, I agree. So the next one is from an anonymous attendee. He or she says, okay, it seems like a she. My child has eczema and allergic rhinitis, which causes mouth breathing. But I don't think he has OSA. Should I be worried? I think he will grow out of it, like my husband who has childhood asthma.
Okay. I think I answered this question just now. Right? Remember, we talked about mouth breathing and what the consequences are and whether you should watch and wait or not. It sounds like your child has this propensity to have enlarged adenoids. Children who have allergies, especially allergic rhinitis, sounds like he's been diagnosed already. He should have his nose scoped and checked if he has enlarged adenoids, and that should be addressed, because if not, he'll be having poor concentration in school, just not being so motivated to go out and play, maybe poor appetite, and as I mentioned just now, poor academic results. Very important in Singapore, right? Yes. So I think we are so afraid of surgery and medications that we don't see the risks of not intervening. I had this conversation with a couple of friends before. A lot of people are very fearful of doing something because then they worry that, oh, then if something bad happens, it's my fault. But the risk of not doing something sometimes is even greater. You might actually give your child a poorer quality of life. Maybe they could have, been able to answer that PSLE question about Helen and Ivan and the number of coins, if they could sleep well at night. Yeah, but no, I'm just saying that we want to give our children the best, and sometimes we're just so fearful of action, but we don't realize that inaction sometimes is the problem, and it causes even greater problems down the road as the child gets older.
Yeah, I think the word surgery really scares a lot of people. But as you can see from your patient, just right after the surgery, he is looking really perky.
Yes.
And then he's recovering so well, even just a short while after surgery as well. So it's not something to be afraid of. And anyway, it will be good to just go to see a doctor or ENT to get checked out to see whether or not you have to do anything. Like there's no harm getting checked out to see what is the next course of action.
Precisely. It may not always have to be surgery. If it's, for example, allergic rhinitis, we can treat that with medications first. Yes. Mm-hmm. Yeah.
Okay. So the next question comes from this guy called Knowledge. He says, "Hello, doctor. If you have never had an episode of tonsillitis, BMI normal, no medical history, is it all right to do tonsil surgery?"
This question is difficult to answer. Are there other problems? Because tonsillitis isn't the only reason to do tonsil surgery. For example, if you're snoring, if you have OSA, then that is a reason to have your tonsils removed. Other reasons include possible risk of a tumor or cancer if one side is enlarged, previous history of a severe infection with pus in the throat, for example. So it's a bit difficult to answer that question because it's quite general, but I have given you some other reasons that you may need tonsil surgery for.
So it's not enough information to really answer.
Yes.
Yeah. So, right. Mr. Knowledge, you can go and see a doctor to check out your specific condition. So the next one will be from anonymous attendee. What if an adult male is overall healthy with no other symptoms except for loud snoring at night? Is it necessary to take corrective action?
I think the correct person to ask is not me, but the sleep partner. Honestly, who does it affect, right? Because right now, the patient or the attendee himself isn't affected. He's healthy. It doesn't affect him at night, but who else is it affecting? Is it affecting your sleeping partner's sleep? Is it affecting the other family members in the same household? And if it really is snoring and without OSA, surgery is a very good treatment for that. Just removal of the tonsils, stiffening of the palate. The success rates are very high to treat snoring. But of course, if you're sleeping alone and there's no one else in the household, then that's fine because snoring in itself without OSA does not cause any complications. Yes.
That's good to know. So the next one comes from this anonymous attendee. And the question is, can a child use the CPAP machine? Is it something a child can use?
Okay, so the answer is that yes, children can use CPAP. I don't expect the compliance rates to be very high though, because like I said, it's not very comfortable even in adults. There's something on their face, on their nose, there are straps around the head. So, I mean, if you've tried putting a mask on your child, I mean, it's not going to be easy. Yes. So the short answer, yes, children can use CPAP. The challenge is in how do we get them to agree to use it. Yes.
Is it something that can be fitted over the child's face? Like, is it a standard size or there's a child mask?
I mean, it has to be fitted to their nose. Yeah, that's right. Yeah. Yeah. Mm-hmm.
Because I think during the presentation for child is usually to remove the tonsils or to do a facial surgery to remove whatever is needed. Yeah, so maybe just wondering whether the CPAP machine is an option, which I suppose it is, but it's not a very good option.
And it is an option, but I think practically speaking, it's going to be difficult. So doing the surgery, removing the tonsils and adenoids, it's just half an hour, 45 minutes. And honestly, children recover so fast. I mean, I think adults, we might take about 2 weeks, children 4 to 5 days, and they're just going to run around like nothing happened.
Then do they have to use it continuously? So actually the next question is from anonymous attendee. They say, Doctor, I'm on a CPAP machine. Must I use it every day? Sometimes I'm lazy to use it, or if I fall asleep and I forget to use it, is it okay? Is it something to use every day?
Yes. Unfortunately, to achieve the benefits of CPAP, you have to use it every day. And if you don't use it, then your airway will collapse, just like I showed in the video, because there's nothing to split the airway open. It's suggested that you should use it at least 5 hours a night, 5 days a week. At least. Yes. So I have patients where they put it on and then halfway, because of discomfort or because they're moving, then it just flies off. So the machine can actually read how many hours they're using. And then I can look at it and I'll tell them, okay, this is not good enough. You got to be using it more. They'll say, no, doctor, but I use every day. And yeah, but it's not enough because you're just using for 2 hours. How can you get good sleep for just 2 hours, right?
How do they use it for 2 hours? They just use it and then it falls off, or they just take it off?
Because it's uncomfortable, or the straps, because they turn and then it comes off. Yeah. So mask fitting is actually an art as well. Our technicians have to make sure that it is suitable for the patient. Yes.
Okay. So we still have more questions, but we also have some time. So if anyone has any questions, remember to just leave it in the Q&A box, and we'll continue on with the questions that we still have at the moment. So this one comes from a guy called Seth. He says, what is the success rate for sleep apnea surgery? Can it be cured in one procedure?
Okay. Overall, I would say about 50%. But the caveat is that it depends on the patient's anatomy. Okay. And it depends on whether the patient is obese. So sleep apnea surgery is not very successful in patients who are obese. So anyone with a BMI above 30 or 33, we generally don't do sleep apnea surgery for them. However, let's talk about an ideal patient. An ideal patient who's slim, BMI 23, 25, large tonsils, a floppy palate. Now, if I do surgery for this patient, I'm pretty sure 90%, 100%, his snoring will stop and he will be cured of his OSA. But that's the ideal patient. We don't have a lot of those ideal patients around. So it has to be very well selected for the surgery to be a success, first of all. Second is that we use surgery typically as an adjunct to other sorts of treatments such as CPAP. So there are many patients, because they're not ideal, they're not thin, they might be overweight, they may have, for example, a very large tongue on top of the floppy palate and the tonsils. So after surgery, they may still have OSA, which is then, we have to then treat it with CPAP usage subsequently. Just that the surgery makes it more comfortable for them to use it at night.
So would you say for an overweight patient, you would recommend them to lose weight first before they go for surgery?
I would say that we would have to do it. First of all, advise CPAP. We always use that as a first line. Let them try it out first. Weight loss is concurrent, whether with CPAP therapy or with surgery. So typically, we give our patients a trial of CPAP first, especially in those who are overweight.
Okay, and one more question about the CPAP is, okay, CPAP is getting a lot of interest. Are CPAP machines very expensive, and where can you buy them?
Okay, so CPAP machines vary in price. They're like any sort of device. You can get it from the mid to high hundreds to a couple $1,000s, for example. So it really depends on the device and how many functions it has, how small it is as well, how portable it is. I would say it depends on your needs to decide what you want to purchase. There are quite a few vendors around in Singapore. They are centered around perhaps Lucky Plaza. I think I've seen some in like Wheelock Place, Shaw Center as well. So many medical device companies actually do sell it. Yes.
Okay, that's good to know. So varying prices depending on your price point.
Yes.
Right. And yeah, so actually we just have another about 8 minutes more before the end of the session. So if anyone has any questions, now is a chance. Just put it in the Q&A box. So we'll move on to the next one. Is there any special positions to sleep in for better breathing? I think like maybe you sit up or sleep on your side or something, maybe will help.
Yes. So in some patients, they have positional OSA, which means that the OSA is relieved or the AHI drops. The AHI drops when they lie on their side. And this can actually be determined on the sleep study. So typically we find that in patients who feel that they get better sleep or they snore less when they lie on their side, we tell them that, yes, please do find methods to allow you to sleep on the side. In the past, people used to do things like sew tennis balls into their t-shirt, but you can imagine it's not the most comfortable. There are other devices which are not available in Singapore, which is like a gyroscope. So it senses your position, and when you're lying on your back, it vibrates. So it makes you turn again to your side. So there are ways to try to get you to sleep sideways, but currently in Singapore, we don't really have a lot of any very good methods to maintain that position.
Yes. But maybe some people, they just feel better sleeping on one side, or if you feel like you have better sleep on one side, then you can just sleep on the side that makes you feel good.
Yeah, as much as possible, but it's not, of course, possible to keep it in that position throughout the whole night. Yeah.
Okay, one from an anonymous attendee. Hi, will you have sleep apnea as you age? Is it something that happens as we age?
Yes, age is actually a risk factor for OSA.
So remember, maybe if you have some kind of problem sleeping, or if your parents have some problem sleeping, then maybe it's because of the age. So there's one question that came in that asks, is there any known link between OSA and risk of getting nose or throat cancer?
No, not to my knowledge.
Okay, good to know. And is there any sleep apnea surgery complications? What are some possible complications from the surgery?
This is quite general because there are so many different types of sleep apnea surgery. So I would say in general, having bleeding, whether from the nose or from the throat, that's one of the common ones. Post-op pain, also very common because we're operating on the throat. Patients actually find that they can't eat so well after, and then they lose weight, which is a very good thing for OSA patients. So I don't know whether you call that a complication, but yes, that happens. One of the biggest issues of OSA surgery, as I mentioned before, is that if you're overweight, we probably wouldn't achieve a cure in terms of the drop in the AHI, but we will improve the AHI. So I think that is something that we have to discuss with the patients to set the expectations right, that in certain types of patients, doing the surgery does not mean that you go off the CPAP completely. It just helps you use the CPAP, and so that it's more comfortable for you, and it doesn't feel so, the pressure isn't so great at night. Yes.
So this is a question from me. Do you have to use a CPAP machine forever? Will it ever go away?
The answer to that is yes, you pretty much have to use it for as long as you have the condition. If you don't, for example, if you don't go for surgery and you don't lose weight, then as you age, your muscle tone becomes worse, right? So we can only expect the problem to become worse as you age. So the truth is, yes, you have to use it for life. There are many patients who have been on it for more than a decade and they're very happy because they sleep well, their spouse sleeps well, and everybody lives happily ever after, isn't it? Just joking, but no, it's true. I mean, I'm joking about the living happily ever after thing, but I think that we underestimate how much the rest of the family feels the relief that they feel when the affected person, I would want to say father or mother, the affected person starts using CPAP. Yes.
Yeah, I think bad sleep doesn't just it can also come off as, of course, you've mentioned like behavioral. If you're under rested, you feel really cranky, you take it out on people around you. So having good sleep is really important, not only for yourself but for all the people around you as well, right?
Yes. Yeah, and especially in this very high stress environment we live in. Yeah.
Good sleep is important.
Thank you for that. Yeah.
Okay, so thank you very much. We're very close to the end of our webinar. So I just want to wrap things up. Thank you so much, Dr. Valerie. And thank you everyone for such an engaging session, putting in all the questions and being or participating with our interactive Q&A session. I've learned a lot of information today. So remember to subscribe to us now. And all this information can also be found in our post-event email, so you can look out for that as well. And if you want to arrange an appointment with Dr. Valerie Tay to have your unique condition assessed and personalized, you can also head over to the Ascend ENT website, and you can also scan the QR code on her virtual background. So before we all go, do click on our Medical Channel Asia's channel, such as our Facebook page, our YouTube channel, and our Instagram. And we also have a TikTok for all the latest updates on our subsequent Doctor On Call events and webinars as well. So thank you everyone for attending. Thank you, Dr. Valerie Tay, for being here today, for spending your evening with us and answering all our questions. Thank you so much.
Thank you very much, Marie.
Thank you. And good night, everyone.
Night.
Bye.
Don't forget to like, comment, and subscribe for your regular dose of Asian health information.